Hi there, it's Dr. Collin from Family First Chiropractic. Hope you're all doing well. So today what I want to do is talk to you about some of the frequently asked questions, some things that people have, the questions about the knee pain, the things that they're experiencing. They come in, hey, what about this? Hey, what about that? Don't worry, I got you. So first question here is going to be, when should you see a chiropractor for knee pain? So ideally that would be as soon as you think there might be something going on with the knee itself. As soon as you think you might have an injury, pain starts coming up, it's best to get it checked out as soon as possible, because the sooner I can get to it, the sooner I can figure out what's going on, the sooner we can get that feeling better and get you back out to doing the things you want, need, and desire to do. How do I know if my knee pain is serious? So in my opinion, all knee pain is serious. It's not normal. It's common. A lot of people have knee pain, but you should always take it seriously, figure out what's going on with it, and get a clear plan on how you're going to get that issue corrected. How can I stop knee pain? So step one with stopping knee pain would be to start on something we call RICing it. RICE is an acronym that stands for rest, ice, compress, and elevate. So doing those four things is a really good way of getting some of that inflammation out of there, getting the joint to work better, and lowering that overall pain level so you can get back to at least functioning, doing some day-to-day stuff. Outside of that, best thing to do would be to get in contact with a knee specialist, a chiropractor, somebody who works a lot with the joints and that can start to get you on that path to healing. Is it better to use heat or ice, especially for knee pain? So that one, it really depends. So it depends on what all you have going on, what you're experiencing. So if it's something that's more recent, you just had an injury, you just noticed it started swelling, ice is definitely the best. Rule of thumb, if you ever have any doubt, go with ice. With the ice, you want to do 20 minutes on, 40 off, and that's really what helps us with getting the inflammation moved out, and 40 minutes is long enough for it to heat back up on its own naturally. And then with heat on the other side of the coin for that, so if it's something that's been around for a long time, you're dealing with this chronic knee pain, it's been months, years that you're dealing with it, sometimes the heat can be more beneficial. If you do use heat, I usually use ice right after, so if it does bring any inflammation with the heat, the ice will help take care of that and get that out too. Should I exercise with knee pain? Again, it depends. What does that exercise look like and what does the knee look like? So if it's light knee pain, it's bugging me, it's a little achy, I'm planning on going out, going for a walk, light jog, something like that, absolutely. Light activity is the best thing you can do for your joints. So the more you can get out and be lightly active, being healthy in that way, the better overall your joint is going to be and the healthier it's going to be. Now, if you're worried that you might have sprained a ligament, torn something, and you really want to get back out and get back to weightlifting, you might want to hold off on that. You should probably talk to somebody, figure out what's going on, and have a clear strategy on how to get back into those higher impact activities before you jump straight back into it.